Hi everyone, my name is Courtney McIntyre. I am a psychiatric mental health nurse practitioner student at the University of Iowa, and I'm going to be providing education on substance use screening, brief intervention, and referral to treatment, which is also known as SBIRT. The objectives for today are to understand the need for adolescent SBIRT, describe how to use the CRAFT screening tool to evaluate the adolescent patient, and describe how to implement SBIRT into practice. In Iowa, almost 8% of adolescents report using drugs in the last month, and 11% use drugs in the last month. Iowa adolescents are 23% more likely to use alcohol than the average American in their age group. Nationally, by 12th grade, almost 50% of teens have tried illicit drugs and 62% have abused alcohol. And between 2015 and 2019, 3,296 adolescents ages 10 through 19 died of an unintentional drug overdose in the US. Substance use in adolescence can negatively affect brain development, increase the risk for other dangerous behaviors, and contribute to heart disease, high blood pressure, and sleep disorders in adulthood. Adolescents' brains are still developing, so they're more vulnerable to the temptation of trying substances as well as to the substance's effects. The earlier adolescents start using substances, the likelihood of developing a substance use disorder later in life increases. The American Academy of Pediatrics recommends providers utilize SBIRT in practice with a universal substance screening tool for all adolescents. However, several studies have found that structured screening is not widely implemented by primary care providers. So before we get started, I just want to talk a little bit about patient confidentiality when it regards to adolescent substance use. So adolescents should be provided the same confidential care indicated under HIPAA. Screening should be completed by the adolescent individually. The parent and guardian can be respectfully asked to leave to wait in the lobby so that you can talk to the adolescent alone, but also notify the parent that you will discuss with them if the adolescent is at risk of harm, which would include injection drug use, other illegal activities, ingestion of potentially fatal amounts of alcohol or substances that could cause overdose. And you can also inform adolescents that this information will be discussed with the parent only if this is something that you find with them. If you do decide to refer the patient, make sure you obtain mental health and substance use disorder release form from the specific clinic the patient is being referred to. So the S in SBIRT is screening. The CRAFT 2.1 screening tool will be used. CRAFT stands for the keyword in each question, which is car, relax, alone, forget, friends, and trouble. The screen is validated for youth ages 12 to 21 to identify substance use and substance-related risk. The 2.1 is just an updated version. It's recommended by several federal organizations. And for the purpose of this project, you will be completing it at adolescent well child checks ages 13 through 18. And one of the reasons this was decided is because 93.8% of children under the age of 18 had a well child visit within the last 12 months in 2019. And well child visits offer the opportunity for screening, prevention, and early intervention with trusted providers. So this is just a great opportunity to talk about substance use, prevention and risks, and intervene if needed. So you're going to administer the CRAFT screening by paper and scan it into the chart. This is offered in English and Spanish, as I know that there are Spanish-speaking patients. Unfortunately, they don't have Marshallese yet, but hopefully that will change in the future. So the opening questions assess the frequency of substance use within the last 12 months. If a patient answers 0 in all 3 of these questions, they only need to answer question 4, which is the car question in the next part. So the car question assesses safety risk regardless of their substance use, and the remaining 5 questions assess substance-related problems. A yes will equal 1 point. with a score of 0 to 6 possible. To interpret the screening results, the risks are categorized. It is not a diagnostic tool, though. The low risk is no use in the past 12 months and answer is no to the CAR question, which would be a CRAF score of 0. Medium risk, there's two different options here: no use in the past 12 months and yes to the CAR question, or they have used in the past 12 months and a CRAF score of 0 or 1. High risk patient would be any use in the past 12 months and a CRAF score of 2 or more. So delaying and preventing the onset of substance use in adolescence is important to reduce the risk of addiction and impaired brain development, which is important on why we're doing the brief intervention, as it can reduce adolescent substance use and their consequences. Providers' response is tailored to the patient's risk of substance use, and that usually includes positive reinforcement, brief advice, and motivational interviewing. So during the brief intervention for low-risk patients, you will be providing information about the risk of substance use and substance use-related riding and driving, offer praise and encouragement, and you can personalize it by building on a person's strength. So anything that they discuss liking or their reasoning of why they don't do drugs, just make sure that you reinforce that behavior and praise them for that. Medium risk patients, provide information about the risks as well as the safety risk of riding and driving. And then you're going to be providing the brief advice and a possible follow-up visit, just depending on your discretion. All patients will receive something called the contract for life, which we will discuss later. So I have a 2.5-minute video for you to watch about a medium risk example.
How are you?
I'm doing fine.
Thanks for your honest answers on the tablet. A lot of people don't feel comfortable being honest with us about stuff like that. It says that you smoked some marijuana over the past year?
Yeah, about 4 months ago.
Yeah, tell me some more about that.
Well, I was just hanging with friends, and it was kind of a rough day, so we all decided to relax.
Okay. And was that the last time that you smoked?
Yeah, it was the last time.
Why haven't you smoked in 4 months?
Lacrosse season started, and I don't like to smoke then.
All right, that's a partially smart decision. Good job on that. I think that you're going to notice that you're going to be able to focus and react better, and you're going to be a better lacrosse player if you're not smoking than if you are. As your doctor, I would suggest that you not smoke marijuana or drink or use other drugs anymore, and not just during the season. Smoking or drinking are going to impact your performance. They're going to cause you some academic problems possibly. And when we drink and use drugs, we end up in situations pretty often that can be embarrassing or very dangerous. What are your plans for after the season?
Well, after the season, I usually do smoke with my friend. Common event.
Mm-hmm. Again, I'd suggest that you try not to do that. What do you think about that?
Yes, it sounds reasonable.
Okay. This is a copy of the contract for life. Have you seen this before?
No.
This is your promise to your parents that you're not going to get in a car and accept a ride with a driver who's been drinking or smoking weed or using any other drugs, and that you're also not going to drive and use drugs or alcohol. And it's your parents' promise to you that they'll be able to offer you a safe ride home anytime that you need it. You haven't smoked for the past 4 months. What if you were in a situation with your friends and somebody had some marijuana and started to smoke during the season? What would you tell them?
Well, we have a policy at school. You get kicked off the team if you caught smoking. So I really don't want to miss this season. It's important. One of the last few I can play.
I've known you for a long time, and I know how important lacrosse is to you and your schoolwork. And I think that you've made a good choice for the season. And I hope you can stick with that choice. And I hope that you won't go back to smoking marijuana after the season ends. You're a good student and you're a good lacrosse player. And you're just going to notice that you're going to be a better student or lacrosse player if you can stop smoking marijuana.
Okay.
All right. Well, good luck.
Thanks.
the high-risk adolescent, adolescent who reports drug use in the past 12 months and a score of greater than or equal to 2, you will want to conduct a further assessment, provide information of risks of substance use and driving or riding under the influence, provide brief advice, and schedule a follow-up visit for 2 to 4 weeks, and then decide about a possible referral to counseling, treatment, or other services. And I also have a video example that's about 3 minutes long of a high-risk patient.
Orly, thank you very much for filling out this tablet questionnaire, and I really appreciate your honesty with these answers. As I was reviewing it, I noticed that you have, in the last 3 months, smoked marijuana, and that you've used it primarily to relax, and also that you've ridden in a car with someone who had either smoked or consumed alcohol. Can you tell me a little more about those things? When do you smoke, and how much do you smoke?
So I smoke on the weekends usually, and we just like share a few joints.
And who's driving when you're in the...
Like my boyfriend drives me to the parties usually, and then we both get high.
Have you thought of not using alcohol or more importantly, marijuana when you're at those parties?
I don't know, I always just smoke.
Well, that's a bit of a concern. I'm concerned about you because that can actually be very dangerous for people to be driving after they've smoked. It can impair their judgment. It can impair their ability to make quick decisions. And sometimes they do things that are embarrassing and they are sorry about afterwards. And sometimes those have really bad consequences. Marijuana use for somebody your age can be a problem. Your brain is still developing and marijuana use can interfere with that. If people are using marijuana to be more relaxed, it may seem in the short term that it's relaxing, but it can have a rebound effect where people are even more anxious and it can trigger some really big anxiety responses. And I would hope that you could think about some other ways to relax besides smoking marijuana. Do you have any ideas what that might be?
I mean, I guess I could go on a run or something.
That's true. If you're feeling stressed, yoga, running, talking with friends, listening to music. And when you're at a party and you're feeling anxious or stressed, what do you think you could do instead of smoking?
I guess like at a party, I don't know, just hang out.
Right. Or, figure out who else is not smoking and talk to them. What are you going to say when your friends say, "Why aren't you smoking?" What do you think you could say?
I mean, I guess I would just tell them that it doesn't feel good to smoke.
Okay.
I don't want to.
All right, that's great. It's super important to have another way to deal with the stress besides smoking. And I will help you think of other solutions for that. And we can try it for a month and you can come back and see me and let me know how things went. And if things went great, great. And if there were some difficulties, we can talk about that so that that doesn't continue to be difficult for you. Does that sound like you could do that?
Yeah.
All right. Well, on that same line, I have this.
So to give some more detail on what should be included in the brief intervention, there is a 5R framework, which stands for review, recommend, writing, driving, response, and reinforce. Review. First, you want to review the screening results. If the patient does not use substances and the score is 0, provide praise and encouragement. But if they do answer yes to anything, you want to investigate all of their answers and review the positive crafts questions. So you're going to want to be asking them, when's the last time you used? How much do you usually use? If possible, find something to praise. Like, okay, you said you've been using a lot frequently, but you haven't used substance in the past month. That's great. What changed? What got you to that point? After review, you want to recommend that they don't use. In the video example, they said something very similar to this. As your provider, I recommend not using alcohol or any drugs because they can harm brain development that can cause problems with learning and memory, lead to other dangerous behaviors like driving or riding under the influence, affect academic success, and put you in situations that are embarrassing, dangerous, or worse. So review, recommend, riding and driving. So if they put no to the car question, to still discuss the risk with them, recommend that they shouldn't ride or drive in a car while using substances, even if they don't seem high or drunk, and to make arrangements ahead of time. So if they're planning to go to a party, just make sure that they know how to find a safe ride home. If they answer yes to the car question, conduct further assessment, ask them about who was riding or driving, what they were using, discuss the risk, recommend against it, and again, make arrangements ahead of time. If a patient says that a family member was the one who was driving, you will want to provide the contract of life with the parent in the room and share it's designed for both parents and teens to agree to not drive under the influence. Either way, the family member, a parent or guardian, is supposed to complete the contract of life too, but just making sure you're handing it to them with them in the room will maybe help ensure that they will complete it and take it seriously for themselves. So the contract of life, there was an example of this in the first video we watched, but it is designed to elicit conversation between parent and child to discuss substance use and driving risks. It encourages parents and teens to work together to create a plan for a safe ride home. So you're going to give this to everybody, regardless of the screening risk. Response. Response is to elicit self-motivational statements. You want to use open-ended questions to try and encourage the adolescent to think of pros and cons to reduce substance use, such as what are some reasons you decide to do substances or use substances, and tailor it to their interests. Like, can you tell me how using this substance might impact your performance in whatever they might be interested in? Or do you have any ideas on what you could do instead of using this substance? And then once they discuss any sort of change talk, like in the lacrosse video, or in the first video, the guy talked about wanting to use lacrosse as an excuse or a reason not to smoke. That would be an example of change talk because it was a desire for him to quit smoking. So when anything comes up like that, repeat a summary of what the patient said and reiterate that that's something that they can do. Low, medium risk patients, ask how a friend would respond of why they don't use alcohol or other substances, and just offer praise for their reasoning. High risk patients, ask what the benefit would be to not using alcohol or drugs, and ask if they have any friends that don't use substances and get their opinion on why they don't think, on why they think they don't use. So the main purpose of this is to get the adolescent to think about their own reasoning of why they shouldn't smoke or use alcohol or other drugs, and try and get them to think about what would be the best option for them on how to reduce or stop that use. Reinforce. So you want to reinforce their self-efficacy. For low and medium risk patients, tell them they have a bright future and you don't want to see alcohol or drugs interfering with achieving their goals and the things that they care about. And again, personalize it with their interests. High risk patients can do the same thing, but also ask for a follow-up visit in 2 to 4 weeks and ask them if they can stop using until their next visit. If the patient says no, discuss reducing risk, even if it's they typically would smoke marijuana in the morning, before school and after school. Ask if they can reduce it to just one time or 1 time a week, something that will encourage them to at least try something different to reduce that use. And reiterate to the patient that you hope they can make an effort in stopping or reducing substance use, since it's the best thing that they can do for their health and success in life. And then at the end of the brief intervention and discussion, you're going to invite parents back, tell them that you discuss the risk of alcohol and drug use with all teenage patients, and then share with them that you gave the contract for life and you'd like them to review it together. So the follow-up visit, you want to review how the past 2 to 4 weeks went, praise any progress, even if it's small, ask about any challenges or barriers they experience, ask about anything that helped reduce or stop their substance use, and ask about what strategies could be used to avoid substance use in the future. And I have one last example for you. It's a few minutes long as well.
Thanks. I think we're going to talk about marijuana. How's it been for you for the last month?
It's been good. I haven't smoked.
That is great. You haven't smoked at all in the past month.
Nope.
Congratulations. May I shake your hand? That's really great. So how did you do that?
I don't know. I thought it would be hard at 1st. I did go to a party, but I got through without smoking.
Okay, that's really good. Did you miss it, or how was the party without smoking?
I mean, it was fine. I didn't really miss it.
Okay, good. What'd you tell your friends? Did they even ask?
Yeah, they asked. I told them that I just don't feel good when I'm smoking and I don't really want to anymore.
Okay, well, that's I'm glad that you can say that and they heard that, and I'm glad that you were able to follow through with that. How'd your boyfriend respond to this?
He's okay with it. I mean, he's gonna keep smoking, but we agreed that he wouldn't drive me while he's under the influence. So
okay, I'm glad to hear that. That's
Yeah.
definitely a safe decision, and I'm really, really proud of you. So good. All right. Do you think you can continue not to smoke? Still make that decision?
Yeah.
All right. Well, then I think you can too. So I wish you the best with this. If you have any questions or want to talk more about it, you know that you can call here or make another appointment. But this is really great. You should be really proud of yourself, and good luck with continuing that.
Thank you.
After their visits, participants
Sorry about that. The screens got mixed up. So at the follow-up visit, if the patient states that they didn't make an attempt to quit or reduce their substance use, there's another 5R framework that can be used. And this includes relevance. So talking with the adolescent why quitting is personally important to him or her. Risks, asking the adolescent to identify any negative consequences that they can think of. And you can certainly help them try and think of things if they can't. But the goal is to try and have them think about how this can negatively influence them. Rewards, ask them to identify potential benefits of quitting. It can be anything that they can think of that is relevant to their life. Roadblocks, ask the adolescent to identify barriers to quitting. Why can't they quit? Do they need support? Is there anything that they are worried about if they do quit? That type of thing. And then repetition. Repeat each time the adolescent visits the clinical setting to reiterate of why they should stop using alcohol or drugs. And don't quit trying to help them quit. Referral to treatment. So a small percentage of adolescents will actually need a referral. You can discern this at the initial appointment and or also at the follow-up if a high-risk patient needs a referral to other resources. Adolescents are able to seek substance use treatment without parental consent, but it is optimal if parents are involved if the adolescent is okay with that. And most of the time they are. I did send a handout in the email for adolescent services in Dubuque and surrounding areas for different counseling options, treatment services, and other like applications that adolescents can download on their phone or internet services that they can look up or text or call that can help support them in quitting or reducing their substance use. So referral to treatment sometimes can sound a little bit overwhelming to refer a kid to treatment, but you just want to think if they might need to be further evaluated, they might need counseling, so maybe they're self-medicating for anxiety and using drugs for that reason, or they just need a little bit of support. And there's so many different applications that can be used nowadays, just download on their phone. They don't even have to go anywhere. So I did, again, put that in your email for you to view and be able to help the adolescents and some family resources as well. So I just wanted to know, again, CRAFT screening is a substance use tool, not a diagnosis. But there have been several studies that have found a score greater than 2 has a high likelihood of a substance use disorder for adolescents ages 14 to 18. So that's just something to keep in mind when you do have a high risk patient, that they are more likely to have a substance use disorder, especially when thinking about if you want to refer them to treatment or further evaluation. So for billing, I also attached a handout for you to review on the coding on how to bill for the services so that you can be reimbursed. So make sure you take a look at those. And just a source note, most of this information was provided by the CRAFT 2.1 Providers Manual, unless otherwise referenced. If you want to learn more information about SBIRT, here's a link. It's also in the references as well. So I wish you guys luck. Thank you very much for your participation and listening to this education, and I hope it goes well for you. And I'll be following